So smoldering myeloma has always been a bit of a difficult nut to crack because we know a significant number of patients start with monoclonal gammopathies, which then eventually advance to smoldering myeloma and ultimately to symptomatic myeloma. So one of the hard things to do is to identify properly smoldering myeloma patients, and then when they get to be high risk or at the right time in the course of the disease is to do an intervention. The most difficult issue here is the standard of care is no therapy. And so to do a trial where patients are randomized between an agent and no therapy is always difficult to do. I think not surprising there was an advantage to the treated group, but the trial presented here uses a relatively expensive drug, namely lenalidomide, and so you need to frame that up in terms of the other traditional markers, because there is definitely an economic issue and we don't want people dying from financial toxicity. But it is a good trial. This one and many others will soon appear, and hopefully we can decide on how much therapy you need if you're smoldering. Because other investigators have used very high doses of things and transplants in an attempt to cure smoldering myeloma. So I think to some extent the jury's still out, but it's nice to have a positive trial.